pharmacies across North Carolina can now sell a life-saving anti-overdose drug called NARCAN without a prescription. NARCAN wipes opioid chemicals from the brain and reverses otherwise fatal overdoses in just a couple of minutes. State health officials say NARCAN is so unique in its life-saving abilities that it should be offered to anyone on demand. The drug has no effect on humans who have no opioids in their system. Dr. Randall Williams is back with us. He is, by the way, the state health director. You know, sir, you did something very few people do. You lobby for a bill through the House and Senate, and they don't give you much grief about it. Congratulations on that.
Well, Kelly, thank you. We are incredibly excited. This is the first time since 1881 and 1877 the state health director has written a standing order for a drug, NARCAN, which we think will save lives. It went through 5 committees that I testified before and 8 votes, and got bipartisan unanimous support at all 8 votes. So,
do pharmacists now know that you have a prescription on file with them that someone can come in and say, I want NARCAN, and they'll sell it to them?
That's a great question, and we wanted to be very proactive. One of the great things about the way we did this, we believe in being very collaborative. So as you went through the 5 committees with the legislature and before the North Carolina Medical Board, the North Carolina Medical Society, the North Carolina Pharmacy Board, talked with the North Carolina Nurses Association, there was a lot of critical thinking. You know, have you thought of this? Have you done that? Are you thinking about this? And one of the ones that certainly came out of the legislature was, how are you going to roll this out? You have to ask for the drug. That's never been done before in North Carolina. So we've been working with the North Carolina Pharmacy Board for about 3 weeks to have this ready to go. So the governor signed this at 1 o'clock on Monday, and it went into effect at 2 o'clock. So you could walk into a pharmacy at 2:30. And I'm incredibly excited to say we're tracking it. And we have 2,000 pharmacies in North Carolina, about 1,200 chain and about 800 or so retail. And we asked them to voluntarily, they don't have to, just to let us know when they're on board. And I looked at it this morning and I couldn't count all the pharmacies that have already volunteered.
Can pharmacists have a conscientious objection to supplying a customer with NARCAN, or does this law compel them to sell NARCAN to anyone who wants it?
No, again, they have to voluntarily participate in it. They don't have to.
Let's talk about the bigger issue here. We need NARCAN because we have a real heroin problem. People like and get hooked on Oxycontin, painkillers, you name it.
Right.
There might be a few people out there who will say, oh, you're treating the symptoms, you're not going after the cure, which is drug abuse. What do you say to that? Because I can understand the argument saying you're just helping these people get along in life and maintain their addiction without telling them what they're doing is wrong.
Well, it's a great point, actually, and something that, again, that came up very much as we went through the Senate and the House. And the answer to that is this, is that we now have more people dying in North Carolina from opioid overdose than we do from either car accidents or HIV. And so we have 20,000 people showing up at ERs for overdoses, for those type of visits. We have 91,000 prescriptions for every 100,000 North Carolinians for narcotics out there. So clearly this piece of the puzzle is just to save lives. And I truly believe in the next month there'll be people whose lives will be saved because of this, because a loved one will have access to it. But to your point, if you look at the evolution of this, the governor signed the Good Samaritan Law in 2013. We've seen tremendous response with that, with 71 law enforcement people carrying that. And then he appointed the governor's task force on mental health and substance use, chaired by Secretary Brazier and the Chief Justice. And in that report is the importance of treatment and getting, it's not enough to save their life, you've then got to get them into treatment.
So here's the deal with the state law. 2 drug users use, 1 ODs, you can call 911. You will not be arrested for trying to get someone some help. That's the way I understand law. Is that
Absolutely.
Policy?
Absolutely.
You have NARCAN. You sell it to any. Is there any age limit on NARCAN? You can buy it at the pharmacy now. You got to be 18 or older, or anybody can buy it.
It's open to anyone.
Will it be always offered as a nasal spray? I understand it's a nasal spray.
Well, there are 3 ways that we covered in North Carolina. You can do the injection, but the vast majority of people are either going to do the nasal spray, which just looks like a bottle of Afrin, or you can get it in a syringe in which you just draw it up and then put it in the nose. You put it in one nostril, wait 2 to 3 minutes. If the person doesn't start breathing again, then you do the other nostril, and you get 2 doses with each kit.
Is it expensive? Is it high priced?
For Medicaid, it's $3. The cost out of pocket's about $110, and that's for the spray. For the injection, it's about $60, and private insurers do cover it.
So what's good practice here? Not that I want to get too deep into that, but someone ODs or is suspected of OD. Do you call 911, then give them an injection up their nose, or do you give them the injection up their nose and then call 911, or see if they breathe and don't call 911?
In a perfect world, Kelly, you do both at the same time. If there's more than one person,
you know that's not going to happen,
right,
because somebody's going to freak out.
Right. So the first thing you do is give the injection up the nose. And then as soon as you do that, because you have 2 minutes to see if they respond, we clearly want you to dial 911. As we look at the experience around the country, about 75% of people do that. One of the concerns that came out of the bill was, well, people will do the injection and then the person will recover, and then they won't call 911, and we'll lose the opportunity to institute recovery or treatment. But when you look at programs around the country that have done this, we don't see that. The same percentage of people will call 911, which is about 75%.
I know of parents who have had trouble with grown adult children who are addicted, and they're grown adults, so you can't do anything with them.
Right.
Should the parents buy this preemptively just in case? Does it give you any peace of mind at all? How do you recommend talking about NARCAN and how to bring it into the family if you need it?
Kelly, I tell people, I was a clinician for 30 years, if you think there's any chance that someone you know or love or care for, that you'd ever be in a situation where you'd be in the room and they're dying, and all but for 1 cc of a drug, they're going to die. But if you had it, they would live. If you find yourself in that situation, or you think that's even a possibility, I would get the drug.
Dr. Randall Williams, thank you very much.
Thank you.